fentanyl overdose protecting lives in demand. These items are on file and available for public inspection in Office of Legislation, 165 Church Street, or Honorable Brian Wingate, Chair Honorable Michael Smart, City Clerk. If you need any related accessibility accommodations, please contact 203-946-7551, voice, or 203-946-8582. In accordance with the City of New Haven COVID-19 policy, masks are now optional. Public may send comments to public testimony newhavencg.gov. Thank you for coming out tonight. We have two items. Before I ask the committee to introduce themselves, we're going to switch items around. We'll do item 2, which is the Caroline item, before we do the Epsilon item. But I will ask the committee to introduce themselves. I'm from my right.
Calendar is at 4 minutes. Congress at 4:30.
Brown Gate, Ward 29, Greenhouse. Frank Douglas, Ward 2.
Brittany Mabry, Hyde, Ward 20. Angel Hubbard, Ward 3.
Thank you. We have two items tonight, but we're going to go out of turn. But whoever's going to speak to the item from the police department, please come up and state your name and address for the record. Absolutely, you can bring them up. As long as they state their name and address for the record, they can come up. Good evening. Hello. Good evening, Carl Jacobson, 15 West Road.
Good evening, Fiona Cohen, representing Fort Cameron, Inc., New Haven nonprofit.
I have the same address, 47 Clark Street, Joseph 30, Fort Cameron. Thank you so much. Please get tickets. So I'll start, if you don't mind. I want to thank their organization, and especially Joe and Fiona, who have done so much for this police department, so much. They've taken a tragedy and the loss of their son, raised money, and then helped us combat things such as mental health for our officers in comfort dogs, and then other items to help with fentanyl overdoses and everything you could think of. We've sat down many times and thought of what can we do to make this community better. In this case, it's a long time coming. Since I became chief, I wanted to equip our officers with Narcan. And we got free Narcan from Dinas and from Hyder, retired Sergeant Bob, who all helped us with that. So we have the Narcan, we just need the pouches for the officers. We're going to commence training, and then all our officers will carry Narcan, which will definitely help save lives in the community.
So I just want to give you a brief history. So when Cameron lost his life, we encountered a lack of awareness surrounding the urgent dangers of illicit fentanyl, specifically counterfeit pills. That day in 2018, even the detectives investigating were not aware the pills were being pressed, stamped with pharmaceutical logos, and sold to victims of something they could safely take. Hence why these deaths fall under the category of poisonings. We were not aware of this danger, and it was only when Cameron's toxicology report came back that we learned of this, and the medical examiner educated us as they were beginning to see this now, as well as street drugs such as heroin being cut with illicit fentanyl. Fast forward to 2020, and it was a full-blown epidemic. We were all caught unaware. We also encountered people who have a stigma surrounding how Cameron lost his life. And the rest of our board who have lost a loved one to fentanyl poisonings have encountered the same stigma. We decided to use our losses to try to advocate for meaningful change in New Haven and our state, but with a specific focus on New Haven, as we know that would have meant so much to Cameron. Our hope is in becoming advocates to save the lives of our victims and to save others from losing their lives in a preventable manner. We have been very blessed in this journey with some very supportive partners. First and foremost, the National Police Department. They've been incredible to us. They have come before this Board of Alders before, as asking you to approve our comfort docs pen and signed. On this journey, we have learned the role trauma plays in the mental well-being of our residents, and we wanted to offer a solution which addresses trauma. Thank you for approving them. They bring us joy, they bring joy to the community, and they do very important work with vulnerable victims. Tonight, I'm here asking you to approve the donation of the North End badges to the New Haven Police Department from our organization. We have put great thought and work into this. We know it's imperative that law enforcement carry Narcan. We first met with the police chiefs 3 years ago this week, as he's mentioned, to try to move this forward for the safety of our residents, but also for the safety of our police officers. So we held a 5K earlier this summer to raise the funds needed to purchase enough of these pouches for the department. We have Narcan as a first aid tool that officers should have available. They hope to never have to use it, but they're prepared if they need to. Many police departments carry tourniquets, which they are prepared to use to save the lives of victims of gun violence. Nobody judges a victim bleeding out for the choices they may or may not have made, which results in a life-threatening injury. Police departments often administer CPR without judging the victim and wondering if they were proactive about their diet and exercise, as maybe they should have been. Officers, particularly New Haven officers who work from a community model, care so much about the well-being of every resident they encounter. The only difference here is the stigma associated with overdoses. New Haven's rate of overdoses remains among the highest in the state, and we have also experienced infants and toddlers accidentally ingesting fentanyl. In at least one case, it led to the loss of a young life here in New Haven. What if the New Haven Police Department at first on the scene of an infant and not prepared? Is that a worthwhile chance? Data shows us that 8% of overdoses often occur in vehicles pulled off roads or in parking lots. Officers are also often pulled off to the side of the road and in parking lots. They may be the first to encounter a victim. We have a mere second to reverse an overdose using Narcan. Waiting for EMTs may be too late. We also know that communities who adopt widespread Narcan use cut their rates of death in half. We, Cameron's family, didn't find him in enough time to save his life. But that doesn't have to be the case for other New Haven residents. We believe the donation of these pouches will make a life-saving change in our community, and we hope you will accept it. Thank you.
Thank you so much. Before I open it up to questions, I just want to give you my condolences once again. Thank you for being a champion around us. From tragedy comes triumph. So thank you for all that you've been doing, and it's always our pleasure to support you in anything we can do with the dogs. So I just want to say that before we open up the questions. I don't know if you want to add a little bit that. This is actually the pouch with the Narcan, so you can see. And I have a pretty state So, members of the Public Safety Committee, my name is Joe Frame, and I'm chair of the advisory board to our nonprofit Fort Cameron. First, once again, I would like to take this time to thank you for approving our dogs, Officer Finn and Officer Son. These two comfort dogs have already had a huge impact on the police department and our community as a whole. So again, thank you. Fort Cameron supports the use of naloxone, training for Narcan, to save lives. Who can administer Narcan in Connecticut? Anyone. Any law enforcement agency, any emergency medical service provider, any government agency, any health organization, any student or employee, any school, and the list goes on. We must give our officers and residents every available chance to overcome an accidental overdose, and naloxone gives them this chance. Currently, only our canine officers carry Narcan to protect their canines. Let me say that again. Currently, only our canine officers carry Narcan to protect their canines. If we have officers carrying Narcan to protect our canines, it makes sense to have our officers carry Narcan to protect our officers and residents. We have worked with police leadership for over 3 years, about 3 years. Now, through our own research, through these best coaches, will make carrying medicaments simple and unobtrusive to the officers in our city. We highly recommend having this approved. Thank you for your time.
So at this time, to anyone has questions or comments? Vice Chair.
Thank you, Mr. Chair. I just want to say, you guys are true heroes for all that you have done for this city and for the residents of this city. This indeed is a lifesaver. I thank you for remembering Cameron by giving back to others to give them a life. I too had a sister that was out there and unpreventable for her to be saved. She died a tragic death on its own, but she was drug dependent. I remember waking up, seeing her on the floor from overdose, and couldn't help her because I didn't know how to. But with this tool, it makes it easier to help others that are out there that need help. And I just want to say thank you for championing this task of what you have to bring to the New Haven Police Department for many lives to be saved. And thank you, Chief, for bringing them here to give us this opportunity to save lives for the officers and for the residents of the city of New Haven. Okay, thank you, Mr. Chair.
Thank you, Vice Chair. Alderman Smith.
Thank you, Mr. Chair. It's always hard to talk after Alderson because you just make us all cry. But I'll try it. But thank you, Joe, Chief. I just have one question, specifically for the Chief. Could you place this initiative within the context of the day-to-day work of the police department? You will, our own front lines and supports a little bit more. Why would this be so valuable? What kind of places into that day-to-day?
Yeah, so, and Joe had mentioned it, not just community and beyond too. This isn't just for the community members. I had 4 officers inflicted with illness due to fentanyl overdose. They're at a scene. 2 of them actually were hospitalized. So even if you only have your own Narcan kit, you can administer it to yourself when you feel those things coming over you. The only recent situation now, this was a struggle from the beginning related to different things like, we have a full-time medical staff that responds. We have, both unions from fire and police. They're not against it, but, we had to deal with those issues coming up to it. And I think what's important is we have seen some situations where police arrived first, medical wasn't there yet, and somebody was in an overdose situation and didn't make it. And who knows if they would have made it if the police had this device with them. And it's very simple. The other part of this is this was more of a medical practice, and over the years it's turned together over the counter. Joe's right, anybody can administer it. So when it came to that level, it was like, hey, this is far, and I blame myself because I've been chief for 2.5 years. I was chief when we started talking, but we should have done it a lot quicker. And on a daily basis, we encounter people in overdose capacity, and we'd be able to use this if needed. Or again, if officers are doing a drug raid and they get inundated with something fentanyl based, they'll be able to use it. So I see it being used almost on a daily basis. Again, we still have a quick medical response. If a person isn't out completely, they'll wait for medical. But this is kind of like a just in case they're already at that level, they'll be able to provide people with money.
Thank you, Chief. Thank you. That's all, Mr. Chair.
Thank you. Any more questions from the committee? I also like to thank you all for your work that you did, Mr. President. And I do have a question for the Chief. A lot of knowledge. I didn't know that. Person, if they felt any overdose symptoms coming out, they could actually administer it to themselves. I think that's
said, thank you for your unfortunate situation that you're turning into a triumph. And a lot of good things are going to come out of what you're doing. And Chief, as always, thank you for your leadership. Thank you for your partnership around this stuff. There's no better time like the present to do what we have to do. Because unfortunately, we can't control all of this stuff. So it's going to go around, right? So thank you for being a big tonight. Thank you so much. I thank the Chief of you guys.
Yes.
Thank you so much. Thank you.
Maybe I don't know about you.
So I don't know until whoever speaking around, number two, please come up. Let's go right here. Chicken dinner, thank stuff like that. No, go ahead, go ahead. We can get stuff like that. You sure? Please come. Thank you. Sure. Got it. So I'm gonna get started. It's one of my favorites.
Okay, so good evening. We're gonna talk about the Axon contract. Yes. We are excited about this. And I don't think. Oh yeah, I'm sorry. Carl Jacobs said 15.
Sean Moore, 76 right. How you doing, officer? Sergeant. Lieutenant.
When you got time, I was thinking 70%.
Give me all the titles tonight.
So we are currently in a contract with Axon for another 2 years. But we wanted to upgrade that contract, get more out of that contract, and be able to move the department forward with better technology. And Sean's gonna break down what different technology is, and it's a nice slideshow. But I'm gonna start off by saying, if we don't take advantage of this now, we wait the 2 years and then start the new contract after 2 years, we're looking, you'll see the total cost of this one for the 5 years is $7.7 million. If we wait, we'd be looking at $10.5 million to $11.5 million. Still getting the same great stuff, but this allows us to, first of all, Axon merged with Fusus. Fusus is our big connection to the cameras in the city. Now that they work with Axon and as part of Axon, we won't be paying Fusus anymore. We contract with Axon for all those services. And Fusus has been great. It's connecting our cameras to our real-time crime center, to our residents, to our businesses throughout the city, and also assists our yes. Yes. The Fusus has already helped us lead to numerous arrests, solve shootings, find missing people. I mean, these cameras are a home run. They're an absolute home run. And Fusus is the hardware that helps run it. It also will integrate with Axon and the body camera, so we'll be able to position by see where our officers are, where our cruisers are, and all that. That's further down. But I want to start off by saying, instead of $10.5 to $11.5 million 2 years from now, we're talking $7.7 million now, and this gets us through 2030. But then I'm going to turn it over to Sean, and I'll let him kind of dig deep on it.
Good evening, everyone. So the chief first came to me and asked me to look into some new technologies to make the officers' jobs more efficient and provide better service to the communities as well as saving the city and the department money in the long term. So that's why we started to look into this contract and negotiating early before the termination, like the chief said, to take advantage of some of the financial savings. So on average, the cost of these contracts to Axon partners go up between 5 and 50% annually. So by doing this now, we lock in 2024 pricing through 2030 rather than starting looking at the 2027 pricing. We also moved the contract to go more in line with the budget year, starting in July rather than our current expiration date of November, which makes it easier for budgetary purposes to go forward with our plan. It also gives us access to some of the new and improved technology systems that have improved over the past 2 years since we first negotiated the contract. I'll speak about some of those a little later. It also enables us to switch over to the TASER 10 from the TASER 7, which is a more reliable, less useful use of force option that has a better reliability in those situations. We also can renegotiate our terms of hardware and efficiency. So there's some hardware costs that were negotiated 2 years ago, in which some of that hardware we do not need any longer, and we need to get that out of the contract now and install it up so that we can take care of those savings and get credits for that hardware. So page 3 is our Axon solutions, which has some of the current things we have, which are mostly state-mandated. So we have cams that have dash cams, tasers. We have Axon interview rooms, which allows detectives to do interviews and get that video directly into evidence.com, so we can restore all their evidence. It also has Axon Air, which is our drones. Just like the chief talked about, and evidence.com. Evidence.com is where officers are saving most of their non-physical evidence in one storage solution, which is easy for them to search and to get to court. The new additions, which is the new technology, which will greatly improve the department, is Respawn Plus. Respawn Plus allows officers and supervisors to live view body cameras anywhere in the field. So if there's a situation in which officers need help or they need to supervise them closely, supervisors can view the body cam live, as well as see where the officer is within the scene. So currently, we can't do that with the Respawn Plus. We can see where officers are at any time, so if someone's calling for help, we can get help to them. Additionally, is Draft 1, which is one of the newest technology additions. Draft 1 is AI-generated summarized police reports. I'll get into more details about that a little later. Additionally, unlimited transcription, which allows interviews to be transcribed automatically, where detectives can look for keywords to go back. So if you have a 3-hour interview and you're looking for one point in that interview that you have, you can look up a word they said, bring it back to that point in the interview so they can get the results done more quickly, investigate more efficiently. Additionally, third-party player. This is a big one. So all the campuses throughout the city have all different types of players. Currently, we get that video, we have to upload it to evidence.com. Detectives want to watch that. They have to download it outside of evidence.com, put it into a computer that's separated from the network of viruses, and then play it on a separate computer. That takes very much a lot of time. This allows detectives to watch it on evidence.com. It's an added feature, which saves them a tremendous amount of time. Virtual reality. This is one is, I think, a game changer for the police department. So currently, we have the virtual system at the police academy that requires labor costs and bringing officers out. It's a very low-cost system, so there's a labor cost associated with it. This will be in addition to that. So we are planning to do monthly training to officers on shoot-don't shoot situations that they can bring these into the department without labor costs, because they can do them in 5 or 10 minutes. So you can go reps of shoot and don't shoot situations and then prepare officers for those situations. And the other addition is the TASER 10, as I spoke about. So let's get a little more detail on Draft 1. So what Draft 1 does is it takes the audio from an officer's body cam and brings it into evidence.com, and then AI generates a summarized police report. So this saved on average officers 65% of their report writing time. What Axon has done is adding a bunch of quality control mechanisms within that. So it's not making any inferences. It only takes the audio, not the video. So it's what people are saying, and it transcribes it. Anything that it doesn't understand is a box that has to be filled out by the officer, and the officer cannot move forward without entering those boxes. It also has a gibberish feature. So part of the mistake is I think cherry coke will be mixed somewhere inside of the narrative, so it shows that the officer had to read the entire narrative to get that piece out. We've already contacted our court, to have our willing and accepting to take these police reports. As the technology, obviously, we work with them and see if that also.
And everything with this will be a pilot program. We're going to select, our 5 best writers, our 5 worst writers, and our 5 medium writers, and put this to work and see if it improves their writing, doesn't improve their writing, and then also work with the court to make sure they're happy with the end product. And, when you think about this, I would say, I've been pushing a patrol car a long time, but I would say 2 hours of your 8-hour shift, maybe more could be writing reports, right? If you imagine 65% of that class, that's an hour and 15 minutes more that they can be driving around the neighborhoods looking, being visibly present. That's our big problem right now. We have the type of thefts that if we have more officers visibly present, it's going to reduce that type of crime. So this is a big one for us, but we're going to make sure it works. And Sean's done a great job. He's put in there that if it doesn't work, we have the ability to not, to get money back off this contract and not use it. So we're going to make sure it works.